Dialogue with a Doctor, featuring Southwest Florida's leading physicians.
Hello and welcome to Dialogue with a Doctor, or welcome back if you've seen our show before. This is a show where we interview local physicians, actually experts in their field. We are interviewing tonight and being taught by tonight two excellent dermatologists who have a practice together in Naples called Skin Wellness, Dr. Daniel Wasserman and Dr. Anne-Marie Tremaine. Yeah. You've been here a shorter period of time, but we want to hear about where they both came from because they're highly trained physicians. Daniel, tell us about yourself.
Sure. So I'm from upstate New York, Syracuse, and I did my medical school in Philadelphia, did my surgical internship at Stanford in California, did a dermatology residency in Boston at both BU and Tufts. Later I did a cosmetic and laser fellowship at Harvard, and then did a Mohs surgery for skin cancer fellowship in Alabama.
And Dr. Tremaine, you intersected with...
Yes. Sort of multiple ways.
Yes,
yeah.
We met several times along the process. But I'm also from upstate New York, from Rochester, New York, and was in Syracuse for med school, and then moved out to Irvine, California, where I did clinical trials for a few years at University, UC Irvine, before doing a dermatology residency. Then moved to Boston for a year to do a cosmetic and laser fellowship at Harvard. Back to California to work for a few years, and then 7 months ago moved down here to Naples.
So both of you know cosmetic dermatology, and that's what our subject is tonight. I neglected to say at the beginning is cosmetic dermatology, and there are 4, maybe 5 R's of cosmetic dermatology. This is the second segment. We've done 2 R's. That was the regimen, and relax. But in the relax, we want to talk more about that just briefly. You were alluding to the fact that people were more aggressive with Botox in the beginning. Mm-hmm. And it did seem like everybody's face was very
cookie cutter.
Yes,
that's right.
And there were objections to that. So how did that change?
So again, I think just to mention something we haven't mentioned yet, everything we're talking about, you can kind of think of things as corrective and maintenance, right? And so whenever you're engaging in a cosmetic procedure, it may be to correct something or to maintain, and the approach is often very different, but to produce the same effect. And that is really to look well, to look rested. When people look well and rested, they look better. And I don't think anybody disagrees with that. So with Botox is really to just soften the tone of the muscles. And what happened is that when Botox first came out, everyone was like, okay, we need to get rid of lines, right? And how do we make lines? We make lines through the muscles of facial expression, which is really nothing, which are the tools we have as a human to provide communication, right? And what we realize over time is that there's ways to look well by softening the tone of those muscles so that you may still have some of those lines, but still look well, still look rested, still look rejuvenated, and never look like you've had anything done. The approach for Botox in a younger patient, so I'll give you an example, someone who comes in for some cosmetic, the cosmetic treatment beginnings at, let's say, your late 30s, early 40s, that would be someone I would talk to about Botox first. That would be a great sort of gateway procedure. If we're going to start talking, like for instance in Naples, where our demographic is a little bit older, we might talk about some other products that actually might provide a more valuable, a better return on their investment. So while the first R we talked about was regimen, the second R was to relax, the third one is really to refill. With refill, I often find, and I think you would agree, that in our demographic down here in Naples, refill is probably the first thing we direct people to. They might come in for laser, they might come in for Botox, and a lot of times we talk to them about refilling. The reason why is that over time, the face loses bone, it loses fat, and it actually reshifts or shifts the muscles in their face, and as a result, the shape of the face changes. So I always tell patients, I go, if you can find those unicorns in our community, those 20-something-year-olds and those teenagers, and look at the shape of their face, it's usually like a rounded egg. As we grow wiser, everything shifts lower, and it's not necessarily because of gravity, it's just because of either gravity or bone loss or fat loss. So the shape of the face actually goes from a rounded egg or a heart-shaped face to more of a pear. We become a little bit more bottom heavy. So what we want to do is we want to sort of recreate or touch up the sort of the gentle silhouette of our face so that we can blend it into becoming a little bit more uplifted. A neat little trick that I do with my patients is everybody, let's say women, will come in a lot of times about the lines around their mouth, the lines, the smile lines or the marionette lines. And I always I do a little bit of an exercise, is while I start talking to them and I'll only look at them around their mouth. And they start to get uncomfortable, they'll start to get down into my line of vision. They say, yeah, I get your point. And I'll continue talking to them to make them squirm in their chair. And I say, we don't talk to each other like that. We talk to each other up here, right? We actually talk to each other eye to eye. But when we look in the mirror, where do we look? We look ourselves here, right? We always are looking at our mouth. We never, that's why there's that saying, look yourself in the eye, because we don't, right? So whenever I'm talking to people about refilling, I'm talking about sort of that deflated beach ball that actually what happens to the face over time. We got to refill that beach ball with air. And so a lot of times we'll talk to them about cheek rejuvenation because everything that happens down here started upstream. The Mississippi River ends in the Delta in the Gulf of Mexico, but started up in Minnesota, right? I think. And so what happens is a lot of times we'll rejuvenate the cheeks, then we start talking about those smile lines, then we start talking about around the mouth. And my goal is to, any good cosmetic dermatologist goal is to never make someone look like they've had anything done. Is to make them look like they're well rested, they look better. People ask you, hey, you look great, and you say, I got my hair done, right? Never to say, oh, I had this procedure. Now, if they want to tell them where they had the procedure, that's great, but I don't, I don't ever expect that. So people are often very private. So that's really what we're looking for with refill. Is there anything I'm missing with refill?
Just that, there are different products that we use to refill. One of the most common ones we use is hyaluronic acid. So that's a natural ingredient in the skin that depletes over time. What's nice about hyaluronic acid is that it hangs on to water, absorbs water. So it's what gives our skin the texture to tone. It makes it look plump and well hydrated. And so many of the products like Juvederm and Restylane, they are hyaluronic acid. And so after your body has started to deplete its own, we inject it back into the skin to temporarily lift and plump, and then over time your body naturally breaks it down. There are other ones that we use as well. There's calcium hydroxyapatite, which is actually very similar to bone.
It's like liquid bone.
It's liquid bone.
Yeah.
And again, that's something that we like to inject into the cheeks because it can really stimulate some collagen growth and really provide a lot of revolumizing of the cheekbone.
Right, and another FDA approval for that product is actually to rejuvenate the hand. I always remember when John McCain was running for president, there was a picture in the New York Times of his wife. I actually think John McCain's wife looks pretty good, but she was pointing at something. And the aesthetics of her face were very different than her hand. And so now we actually have fillers for the hand. So when people get that sort of atrophied, bony hand, you can actually inject fillers into the back of the hands to actually soften and blend the appearance of that hand.
That's interesting.
Yeah. The thing is, though, I want to say is with fillers is that there are some, like the hyaluronic acid, which is nice about the fillers, is that they can be reversed. For instance, with the liquid bone, you can't. And so we also have some other fillers which actually take time to, you actually inject it, and I call it the Cinderella story. You get injected, you look great, you're ready to leave the office. By midnight, it's gone. Because most of it was saline and lidocaine, but the material that's sort of like a sediment that's in it actually stimulates you to produce you. And you actually fill over time, and that's usually a multi-treatment process. So we have a lot of fillers, and actually that brings my point. Whenever I meet a patient for the first time, I say, I don't care where you go, but just ask them what fillers they use. If they use one filler, it's probably not the place you want to be, because different fillers have different niches. And if they're a one-trick pony, they probably don't know what they're doing. So I always say you want to go to someone who's probably using a lot of different products because they understand the different demands and the different needs of the face for overall improvement.
So the hyaluronic acid, the calcium bone, liquid bone.
Liquid bone.
And you alluded to something that stimulates you to produce you. Is that beyond these?
That's poly-L-lactic acid.
Say
Yeah.
that.
Poly-L-lactic acid.
Poly-L-lactic acid.
Yes.
It's been around actually that's actually has an interesting story. It's been around since the 60s. And in fact, they used to, I think, inject it into bone at a much stronger, denser concentration in orthopedics, if you go back to the old literature. And they found is that if you really dilute this down, you can actually produce collagen. So the first place we started using this was in the post-HIV epidemic. What was happening is in HIV patients, you can get a lot of atrophy in the cheeks and in the temples. So when this product first came to market, it actually had a medical indication. You actually could get insurance to cover for it in HIV lipoatrophy. And then what we found is we further sort of blended the product, diluted it down a little bit more. We could actually use it very diversely in the face, almost create sort of like a liquid facelift. We can use it in the temples, the cheeks, and sort of do a total face rejuvenation.
How long do these products last?
Some products actually last 6 to 9 months. The ones that you use in sort of finer lines and areas where there's more movement, that are less stiff, they can last anywhere from 4 to 9 months. The bigger volumizers like the Volumas or the Restylane lifts, they might have a 12, some of them will say 24 months. I sometimes think the company oversells it. So I'll say 12 months. If you get more than that, great. And the Sculptra, actually they say 2 or more years. I actually do agree with that. I actually think they do get 2 years. So it depends, but you don't always want something to last a really long time because our face ages and we may not respond to that filler really well.
Before we get on to the last R, because I think there's one more R, are there biologics now being injected into the face, stem cells, these kinds of products?
Yes, and the research on that is sort of semi-voodoo.
Yeah.
I don't put
edgy.
a lot of weight. Yeah, I don't put a lot of weight into it. So I think you got to think like, okay, if you put saline into the face, you're going to create a lift. The question is, are you really creating a biologic, organic change to the skin that these products are trying to sort of quote? And I don't believe they are.
Well, they are in the market now, right?
They are definitely in the market. There's definitely people doing it because anytime that something is new, it gets a lot of excitement. So there are those stem cell, like sort of like spin down your blood. We do that with fat. Now, the fat injections are actually something that I do. I personally don't do them. I have my own feelings about the fat injections, but they have a very nice track record. So that's sort of a biologic injection.
So what is your last R of the 4 R's?
The last R is to resurface, which is something that we do with laser and light sources, where we are now addressing the skin, the epidermis and the dermis. And so this is a very broad topic. I think sometimes people think we have one laser that we kind of shoot at every problem. That's really not the case. There's multiple different wavelengths of light that we use. There's different technology, and so I'll be speaking very broadly. But the goal is to harness heat, harness the energy of the laser and the light to actually create a permanent change in the skin. So for instance, using a laser to stimulate new collagen growth, which will then soften the appearance of fine lines and wrinkles. And so there are multiple conditions, both medical and cosmetic and medical conditions that we can treat with lasers, including we can specifically target broken blood vessels and redness in the skin on the face, neck, and chest in particular, whether it's because a patient has a history of rosacea or from too much sun exposure. We can improve the appearance or completely remove the brown age spots on the face and body. We can do hair removal with laser devices. We can improve the appearance of acne scars and surgical or traumatic scars. So in our office, we have multiple different lasers and devices, and so you come in for a consult, and based on your personal history, past medical history, your skin type, and your concerns, we choose the device and the treatment that is best for you. So it's not a cookie cutter type plan. You really need a treatment plan created just for you. And so then people also ask, what is the downtime, how many treatments, what are the side effects, and again, that really depends on what condition are we treating and what device am I using. So it's really important to have a consultation with a board-certified dermatologist or someone with similar training that can create a plan just that's for you.
Well, we really appreciate you coming to the show tonight, both of you. I think everybody has learned a lot, especially myself. We'd like you all to come back to Dialogue with the Doctor, and we'd like you to come back again and talk about more dermatological subjects.
We'd love to.
You would. Thank you for coming.
Thank you
Thank
for having
you.
us.